Welcome to our presentation on disaster preparedness by Laurel Spires and Alyssa Dunn. What is a disaster? Disasters can take many different shapes and forms and can happen at any time. According to Chitty and Black, a disaster is defined as an event or situation that is of greater magnitude than an emergency. It disrupts essential services such as housing, transportation, communications, sanitation, water, and healthcare, and requires the response of people outside the community affected. Disasters can occur naturally or be man-made, and can be accidental or acts of terrorism. They are classified as natural, environmental, chemical, biological, radiological, and explosive incidents. Examples of disasters include floods, tornadoes, tsunamis, wildfires, earthquakes, hurricanes, bombs, and acts of terrorism. Nurses are key to disaster response and emergency preparedness. Since Florence Nightingale demonstrated to the world the important role that nurses play on the front lines of responding to disasters, the field of public health and disaster nursing has continued to expand its scope and define its significance. Information, communication, and education are vital for nurses to do the most good and be of the most help during a disaster. In preparation for a disaster, a nurse should be familiar with their facility's role and emergency response plan in advance. They should also keep up to date about any revisions to the plan. Knowing this information in advance will provide nurses with the time to learn and practice the necessary skills beforehand. Understanding who contact people are and the chain of command for a disaster will help ensure that nurses can be deployed where they are needed most. Being knowledgeable about the use of all emergency equipment and practicing operating all emergency communication devices is essential before the disaster occurs. Regularly practiced drills will help ensure nurses are ready for any disaster. During a disaster, chaos and confusion are commonplace. Being prepared for how to handle these kinds of stressful situations will enable the nurse to provide the best possible care. For example, knowing in advance who a nurse can and cannot release patient information to is important. If the media gets involved and approaches a nurse, it's important to know what, if any, information they are allowed to share. When being assigned roles in a disaster, the nurse should be placed in a role comparable to her education and training. Public health nurses need to be flexible about the types of assignments and duties they take on during a disaster without going beyond their knowledge, skills, and authority. This will ensure that the patients get the quality care they need. During an emergency event, this may not always be possible, but the best effort should be made to place each nurse in an area with patient issues she or he is capable and confident with. When a disaster occurs, nurses may be faced with difficult conditions that make caring for a patient difficult. Standards of care may change during these situations. Essential services, such as electricity and water, may be interrupted. Public communication may not be readily available after a disaster, which can cause people to panic. In some cases, power cannot be restored for days or even weeks. This can be due to a shortage of workers, lack of transportation, or limited access to affected areas to make repairs. Nurses may face a sudden increase in patients with severe injuries or other complicated conditions. Situations like these will require a nurse to use critical thinking skills and to make decisions very quickly. Nurses should participate in continuing education classes to ensure they are adequately prepared to serve when a disaster occurs. As environmental, political, or societal conditions change, the nature of disasters will also change. Strategies, methods, and technologies used for disaster response will be adapted to meet these changes. Different equipment might be used and additional training might be required. Participation in emergency response and disaster drills, exercises, and training programs designed for disaster preparedness go hand in hand with continuing education and will help a nurse feel prepared for any type of disaster. Sharing experiences and making comments can help improve current response plans. Nurses can involve and educate communities about disaster preparedness, which will be beneficial when an actual disaster does occur. Legal issues can affect the practice of nursing in disasters and emergencies. When large-scale disasters take place, oftentimes resources are drained and assistance is needed from surrounding states. There are federal laws in place that allow licensed nurses to practice in other states in these types of situations. Nurses should carry a copy of their nursing license with them. The Good Samaritan laws generally provide liability protection to healthcare providers for situations where emergency care is rendered using reasonable and prudent judgment for the circumstances. Most states have enacted some form of this law to protect healthcare professionals from lawsuits for injuries that might result from a Good Samaritan Act. Nurses have always played an important role in caring for others in times of crises and tragedy. Disastrous events occur now more frequently in the United States than ever before. It is therefore essential for nurses to be prepared to respond to a disaster at a moment's notice. Nurses can have a huge effect during a disaster. They are one of the largest groups of healthcare providers in the United States. Nurses are trained to provide for the physical, psychological, and spiritual needs of their patients, and can help save lives in emergency situations.